Welcome to Behind the Mask, episode 2, where real plastic surgery experts break down real-life cases from the most bizarre to the hottest trends. We're going to take you behind the mask to get unfiltered analysis from our true experts. I'm your co-host, Dr. Bill Adams, with my co-host, the world-renowned plastic surgeon, Dr. Jason Posner from Boca Raton, Florida, and our special guest expert, swimsuit model for Sports Illustrated and Dallas plastic surgery consultant, Ellery Milligram. How are both of y'all doing today, team?
Fantastic. Happy to be here.
Me too, Bill. Happy to be here, guys, with the esteemed Sports Illustrated model, Ellery.
Yes, it's incredible. She is incredible and very smart. So we're going to learn a lot from her today. So let's get into our first clip, Ellery. This is a clip from Botched. It's kind of interesting, but see what you think.
So I used to have about 1,000, but eventually they gave me back problems.
So you took them out and put in what?
To 540. My ultimate goal is to go back to 1,000.
You can see rippling. If you think you have rippling now, imagine how thin the skin and soft tissue is going to be with much bigger implants.
Ellery?
Okay, so first of all, 1,000 cc implants. I haven't seen that ever in my life. I mean, I've never held one, but I actually have done some research for talking to patients about the weight of implants, because patients will ask me, and so I like to compare it to regular things. So 1,000 cc implants times 2 is the equivalent to about 5 pounds. That is equivalent to like the weight of a bag of sugar at the grocery store. Also, it's similar to 4 soccer balls and 5 bananas.
It's like a
Fun fact.
5-pound dumbbell and you're hanging off your chest.
Pretty much.
Jason, what did you think?
You know, you look at her and you go, does she want her boobs to match her lips? I mean, is that what she's trying to do? I mean, you know, she has not enough skin to really keep covering what she has now. We always see these problems of skin problems. If you stretch her out, she's going to sag and look worse. And, you know, I've seen way bigger implants than that. And generally, they don't do well in longevity. They just do not. They stretch out and they look terrible.
What are your thoughts? I mean, that kind of goes against.
My first, only thing going through my head watching that clip was Gong Show, big letters, you know. But I do agree with facial plastic ENT guy that, I mean, there's more going on, just that she's got some physical things that she wants to get bigger implants. I mean, I think mentally,
yes,
she's in a weird place, and that needs to be kind of rehabilitated a little bit, and she needs to get in a better place there. Certainly needs to gain weight. It kind of, I think it sends the wrong message about plastic surgery. I mean, that is not a typical plastic surgery patient at all.
But she's looking for attention. I mean, she wants attention. Maybe she works on OnlyFans and makes money on OnlyFans or has her account. I mean, she wants the attention. That's why she's on this show, and that's why she's asking for huge. Who knows? I mean, you know, this is not our normal patient. You know, our normal patient is the mother of 3 looking for a lift after kids. But
those are the most difficult cases. Is a tissue problem. She's like underweight, severely underweight. She's got big implants. She's got thin skin. It's tough to replace soft tissue. Jason, you kind of articulated the issues in terms of support, but the soft tissue, it's very hard to replace that. You know, in breast reconstruction, we would do things you're doing stuff, you're not going to do that in aesthetic surgery, these big flaps and other things like that. And you know, what this, I always go back to this when I'm educating surgeons, but it's always like your first choice is your opportunity to make the best decision. And if you make a good decision, picking implants that fit your breast, you don't end up with these problems with your soft tissue, because a lot of them are uncorrectable. You know, there's things we can do, we can make it better, but it's never anywhere close to as good as a well-planned, good decision by the patient and the surgeon and executed, you know, breast augmentation or breast lift with an augmentation. Those can last for, I saw a patient today, her implants are 20 years old. We did ultrasound, still intact, looks great. Almost looks like it looked, you know, a year after surgery. All right, well, let's segue to our next question. Ellery, I think you found this question, but it's about the COVID-19 vaccine and facial fillers. You know, there's been some anecdotal reports, I think 3 cases or people that had facial fillers a few months before, and then got the COVID-19 vaccine. They had some little small minor infection, and there's been some questions about that. So Ellery, tell us about this and what your thoughts are.
Okay, so as far as patients saying that they have a reaction to getting filler at any point after getting the COVID vaccine, I feel like in general with COVID, there's not enough scientific research done just in general for us to blame a reaction with fillers on COVID. And then just furthermore, you have just natural reactions to filler. Mm-hmm. I don't think that it's fair to blame it on fillers unless we can actually, prove that.
Yeah, well, Jason you said, you got some questions. I think we all probably got some questions about this. The question is it just an anecdotal thing? Has nothing to do with the vaccine? There's not a lot of data.
We read this report. We got 1 million questions from patients, and then it died. We haven't heard about this for a month or two. In South Florida, we have a lot of people over 65. We have a lot of people vaccinated. Our governor is doing a terrific job vaccinating our state. I have not seen this problem. We do a ton of fillers in my med spa. We have not seen this problem personally, but it's one of those things. So let's say someone has fillers and they had the vaccine and they have a little swelling. Okay, worst case scenario, we give them a Medrol dose pack. It's calmed down. There's no sequela. So get the vaccine. That's my suggestion. If you have opportunity, get the vaccine. Bill and I have both been vaccinated. It's a breath of fresh air and relief when you've had it done.
Yeah, this is classic anecdotal kind of things that people kind of come to these rash conclusions that just because there's 3 people that have a complication that's known, it's pretty minor, it's easily treated. In these studies, they didn't follow people enough for us to even figure out any of the details around these 3 cases. There's only 3 cases. There's literally over hundreds of thousands of people in these studies. So it's just, I think it's just an anecdotal finding. Doesn't mean anything, but it's probably like the same people that are saying like, oh, yeah, they put a microchip in you if you get the vaccine or something like that. So
it's not a reason not to get the vaccine.
And it's also not a reason not to get fillers. I mean, when you make an appointment for that, they're probably booked out pretty far. And so you need to take that appointment. Now, if they're at the same time, definitely choose the vaccine over the fillers, but don't let it stop you from living your best life.
So that's a good question. So you got your vaccine. How long should I wait to get fillers? Man, there's no answers to this, but my thoughts would be about a week. Wait a week or so.
Yeah, just, because if you get it the same day, there are some people that can have a little bit of reaction where they can have a little fever or get flu-like symptoms. I think, Jason, you had a little symptoms, right?
I had 100. Yeah. I had it in the morning, like 8 o'clock in the morning, and that night I had like 102.5. Next day I was fine.
Yeah, we studied that, and it was like the people with weaker constitution and stuff have symptoms.
Just overworked,
that's probably why
tired.
Ellery didn't have any. I didn't have any, but you did.
I did.
I gotta say, I mean, I don't mean it to be controversial, but I don't think that there's a better time to get fillers than after you've been vaccinated, because as we start to kind of open up and reveal our faces again after a year of, hiding in our houses, within reason, when we can get out in public again safely and all that, I think it's a great time. You get your vaccination and you're doing your part, and then you reward yourself with fillers and show off your confident self.
All right, well, let's segue to our next segment. And this, Ellery, is one of the most common questions that plastic surgeons get. I want a breast augmentation, but do I need a breast lift? So I'm gonna walk you through just a little presentation just to start the conversation, then you and Jason can fill in the blanks. But this is a classic patient, comes to you. She's saying that she wants to have her breast rejuvenated, she wants to be perkier, but the question is, does she need a breast augmentation or does she need a breast lift or a breast lift with augmentation? So classically, we've done what's called look at the degree of ptosis, which is the relationship of where the nipple is to the inframammary fold, and people that have their nipple below their inframammary fold have what's called a grade 2 ptosis, and they classically would need a breast lift. Now, that's a decent way of doing it, but it doesn't always work. What we actually like to do is something we published a paper on, and this is where we measure the breast a certain way, and we can quantify the amount of looseness in the breast. And we can basically characterize that it's either moderate laxity or significant laxity, skin looseness. That's what laxity means. And so in this patient, we did that. and we can see that she actually has moderate skin looseness. So if they have these type of measurements, we know that she can be treated just with the breast implant. So this is her. She's actually a general surgeon, and she is 2 years after the surgery. She's done quite well with that. But it's kind of something that we don't have to kind of wonder if it's going to work. We know we can measure people objectively. Now, you can have a patient like this. We measured this patient, and she has some different measurements. She has more skin looseness in her breast. She really can't do well just with the implant. We'll talk about this, but some people will say, oh, well, we can put in this big implant and it'll fill out the breast and you won't need a breast lift. That sounds good, but it doesn't work very well. But you can see this patient had a breast lift with the implant. Works very well. This is after a year after surgery. She has great restoration of shape, good perkiness in her breast. So that's just a little glimpse of how we decide whether somebody needs just a breast implant for a breast augmentation or something more than that, a breast lift with implant. So Jason, what do you think?
So Bill, I think it's phenomenal. So Bill, what you've taken is something that your experience level, and you took your experience level and you translated it into measurements so this could be taught to other surgeons. After a while, you look at a patient like, oh, you need a lift, But as we were talking earlier before we got on this call, I've never had a patient who comes in and says, I want scars. Everybody says, I want boobs like a 25-year-old should have with no scars, even though I've had 4 kids and I gained and lost 100 pounds. It doesn't work like that. So most of the adages, if you think you need a lift, you probably do need a lift. But as Bill showed you, those people who have pretty good skin quality, who don't really have significant displacement of their nipple, can get away with just implants. But it's an experienced surgeon who can make that call.
What I always tell patients is when in doubt, if Dr. Adams recommends a lift, it's because we want to increase the longevity of your results. And as much as we love having you around in the office, we don't want to see you back again. AKA, we don't want you back in here in a few years saying, I wish that my breasts that they had more volume, when, Dr. Adams knew on the front end that a lift would be the best move for you. And scars aside, that's what's going to give you the maximum outcome.
I've been getting educated by Jason the past year about all these kind of devices that you can use to really improve the scars, and we've been incorporating that into our scar therapy. And
people want to do something. When I think the days of the patient coming in and the doctor saying, well, just it'll heal, it'll go away eventually. People don't want to hear that. They want to do something. And we found that, I'm not sure the long-term lasers have an effect, but in the short term, they accelerate the response to get to the end where you really can't see the scars. So, my Tuesday night, this is a Tuesday, I just did a lot of scars on breast and, facial stuff. I think it really does help.
Yeah, no doubt. And the thing about this is patients do come in, the patients are looking to us for the advice and expert opinion, but we listen to the patient too, but when people come in, they say, I want a breast augmentation, but they're looking for a result. They're looking for better shape to their breast. So it may be that they can get that with a breast augmentation, but it may be they're going to get a much better result doing a breast lift with the implant, because they need to do that in order to get good shape. And I think what we found is that even though most people don't, it's natural. Would you rather have something with less scars or more scars? It's not like a binary thing. It's more complicated than that, because if you want to do something with less scars but you're going to get bad shape to your breast, that's not going to be good. That you're going to be very unhappy about that. And what we found is that once the patients are educated about the different options and why certain ones may be better for them, oftentimes, especially after surgery, the shape is so much better if they do a breast lift and an implant, for example, or a breast lift, that the scars are a non-issue. And then we can treat the scars like Jason's been showing me, and we have a scar therapy program. So it is more complicated, but we do listen to the patients. And I think the one thing, Jason, is that worth mentioning for patients, because I think it is pretty rampant out there where people are just telling patients, oh, no, you just put a big implant in and you'll be fine. And that oftentimes doesn't work out well, does it?
No, I used to see that all the time, and the patients were very unhappy. And they're, really, how many times did you put an implant into someone who was saggy, and 6 months later, they're just saggier? So, also one of the things that we're doing, and Bill and I talk a lot about this, is, using some mesh for support during these lifts. Because if you have horrible tissue quality. Even if you do a lift with implants and put scars on there, they're going to droop more. So those patients with crappy skin quality, after a bunch of kids or just bad skin, I use Galaflex mesh, and we've had it's completely changed my world. I used to go back on these patients they used to come back 6 months later with fuller, droopier breast after a lift, and now they're 5-6 years later, they're up there from the mesh. So do your homework. Don't go to don't listen. Go to a few consultations. Go to different doctors, see what they recommend. If 3 surgeons say get a lift and the last one says, oh no, we'll put big implants in, you run away from that last surgeon fast.
You know what they don't say when you see, females out there and their breasts are super perky and you don't know because they've got like a push-up bra, let's say, or maybe they got a lift. They don't tell you how many times they've gone under the knife. So you see these females and you're like, wow, I want to look like her, but you don't know how many times she's had to do a revision or, the bra she's trying to wear to make it happen. I think that we talk about, when you hear plastic surgery, it's just so mainstream to just think about breast augmentation straight up. But I think we should normalize breast lifts. They should just come to light more. It should just be, another surgery that's super mainstream. Breast lifts are normal, and if they're recommended, do it.
I probably do far more breast lifts than I do primary augmentations these days. It's just the nature of where we are seeing older patients.
And there are some patients, Jason, I'm sure you've had patients like this, that after all the discussion, education, they just really aren't ready to do a breast lift, and they shouldn't do a breast lift. And they can be done in a state. They can have an implant and then come back and do a breast lift. And that's it's a perfectly good way to do it.
But a lot of surgeons still recommend doing that procedure in 2 stages. I think if I did that, I'd be broke. But we that's a good way. Some people can get them done, but also the surgeons say, oh no, it's too dangerous to do a breast lift with implants at the same time. That's not current thinking. Current thinking is, you can do a successful job if you know what you're doing. It's more complicated, but that's why you go to someone experienced to do this.
Yeah. Well, that's great stuff. Thanks for joining us this week on Behind the Mask. You can find us on our YouTube channel or theplasticsurgerychannel.com. For Dr. Jason Posner and Ellie Milliger, I'm Dr. Bill Adams. Until next time.